Welcome. My name is Maaser from Lüneburg in the northern part of Germany, and I'm the current chair of the International Bowel Ultrasound group called IBUS. In the next couple of minutes, I would like to give you a short introduction on what the IBUS group is about and who is behind IBUS. IBUS was founded in 2014 as a non-profit organization by IBD gastrologists who are enthusiastic for using intestinal ultrasound as an important tool to monitor our IBD patients. Before going into more detail about the educational as well as scientific program of the IBUS group, let me give you a few reasons for why IUS is helpful in monitoring our IBD patients. I think it's very clear to all of us treating IBD patients that no clinical symptoms does not necessarily mean no clinical activity. For example, every one of us has seen Crohn's disease patients with ileal disease reporting to feel absolutely well, but when performing cross-sectional imaging, realizing that there is still a significant ongoing inflammation, sometimes even with fistulas or abscesses with an only mildly elevated inflammatory lab parameter. Colonoscopy, long thought as the gold standard, has the known limitation of being interventional, needing preparation, and, not to forget, only showing the intestinal lumen. MRI, as well as IUS, both are able to look at the complete abdominal wall, including looking beyond the abdominal wall. However, IUS offers the relevant advantage of no need of preparation and being used in a point-of-care setting. This way, the treating gastrologist can interact with the patient, showing improvement caused by the therapy, but also explaining that there is still some ongoing inflammation left requiring the continuation of the treatment, despite maybe the fact that the patient is asymptomatic, which often could lead to not continuing therapy, because why should you continue a therapy if you feel well? In addition, IUS is not only very less cost-intensive, so it's not cheap, but it doesn't cost much, but it's also without side effects, and it can be repeated in short intervals. The question now is, how can I learn intestinal ultrasound if this is not part of my training curriculum as a gastrologist? As this is a very frequent question, as in most countries, ultrasound is only performed by radiologists and not gastrologists, IBUS has developed a training curriculum consisting of 3 parts. Part 1 is a 2.5-day hands-on workshop with the aim of learning on how to set the machine, how to find normal bowel in healthy volunteers, as well as inflamed bowel in IBD patients. Due to the COVID pandemic, we had to change the format to virtual format currently, but we are very much hoping for getting back to real hands-on workshops in the not-too-far future. The next step after the part 1 is a 4-week internship at one of the IBUS training centers. During those 4 weeks, participants perform several IUS examinations on a daily routine basis in outpatients clinic as well as in inpatients, actively learning on how to use intestinal ultrasound, how to find the inflamed bowel, and how to find complications. Finishing this part enables the participants to get back to their home hospital and then introduce intestinal ultrasound in their own clinic. Part 3 is a collaboration with ECHO, the Advanced IUS Imaging course. Further educational activities are, for example, our monthly webinars dealing with various IUS aspects. The other big column of our IBUS group is this about research looking at IUS and IBD, as there are still many open questions, such as outcome studies. Our largest current project is the development of a validated Crohn's disease activity score, which is funded by the Helmsley Foundation with $3.5 million, but there are various ongoing projects which are very interactively discussed within our group. Furthermore, we are yearly handing out an IBUS ECHO research grant in the amount of €20,000, and you can find more details on the application process on our homepage. I now invite you to explore our group in more detail on our homepage, and we are more than happy to personally answer any open questions. The current IBUS board consists of 30 members from around the world, and we also invite you to join our membership meetings, as these are good opportunities to get to know each other and to get introduced to intestinal ultrasound and colleagues that are actively using this for monitoring their patients.